Okay, good morning everyone. Welcome to the FKP seminar series hosted today by SMERU Research Institute. My name is Widjajanti. I'm a researcher here and I will be moderating for today's discussion. Today we're going to have a presentation by Today we're going to have a presentation by Mrs. Widjajanti Isdijoso, the Deputy Director of SMERU Research Institute and one of the principal researchers on the child poverty study. And she will present her presentation titled Child Poverty and Disparity in Indonesia with 2012 update. A little bit about this research. This presentation will highlight the key findings from the child poverty study conducted by SMERU with support by UNICEF and Pembangunan. The research was conducted back in 2010, so therefore in this presentation there will be an update with 2012 data for the key data and key findings. The final report of this study has just been published, and I think it can be downloaded at the website. And it will be distributed to. In addition, so with that, without further ado, we're going to start the presentation today. Please keep your phone on silent mode, I'll turn it off, and we're going to have a discussion afterwards. So keep your question until the presentation is finished. Ms. Guati, the floor is yours. Thank you.
Thank you, Rio, and thank you for the participations of all of you who are coming a long way to come to this seminar. Today I would like to present about child poverty and disparity in Indonesia. As Rio has been mentioned, so back in 2010, SMERU, with the support of UNICEF and Pembangunan, conducted the first child poverty and disparity study in Indonesia. And this study are mostly using the guidelines provided by UNICEF in a global guideline for child poverty study. So the methodology is almost the same with the worldwide study on child poverty and disparity. And because this is the first attempt to do child poverty and disparity study in Indonesia, so it takes quite a long time for us to complete, and going through various review, and finally at the beginning of this year the report has been officially published by UNICEF, and it is now available in the UNICEF and SMERU website, and I think this the copy will be also distributed to all of you who attended this forum. So my presentations will be consist of a background to the study, and then just a brief overview of the children's in Indonesian context, the demographic context of children in Indonesia. And then I will highlight some findings from the study in 2010 and 2011. And at the end, I will provide you with some updates from the 2012 data. But this is still an ongoing process, so I will provide only some preliminary findings from analysis, so it's not yet completed. So I hope that your inputs will be taken into account for us to complete this update process. I think this is only a background of why we need to analyze child poverty. In the worldwide, children's are there's a high incidence of child poverty worldwide, and children are experiencing poverty different with the adult because they are overworked and they are basically they are voiceless because they are not participating in formulating government's policy, and they depend very much on the parents to take care of them. And child poverty also important because this poverty spreads poverty. So today's child poverty will be the future poverty. So by addressing child poverty, we can ensure that the future poverty will be can be sustainably reduced. So this is becoming very important. So prior knowledge on child poverty will be very important to make the more child-centric interventions for government policy, including social protection, which is now becoming more and more developed in Indonesia. And background about this study itself, maybe some of you who already being consulted during the study process in 2010, maybe already know about this, but I need to explain this just for you who are for the first time engaged in this discussion. So back in 2010 and 2011, SMERU, supported by UNICEF Indonesia and also Pembangunan, conducted the child poverty and disparity study. And the objective is to present the evidence-based analysis on the conditions of children living in poverty. So, and also to understanding the gaps and opportunity in national and regional institutional setting for policy support. So basically in this, the report is quite big, I think. It consists of some data, picking on the data, and also discussion about some policies related to various dimensions of child poverty. So it's not only the monetary approach, but also the other dimension, including education, health, and nutrition, shelter, water, sanitation, and also child protections, including birth registration, child labor, violence against children, and children in outside of parental care, and also the social protections. And this study are basically using the available national data set, mostly SUSENAS, but it is also complemented with demographic and health survey, and also risk assessed the 2007 and 2010. And it was also complemented with a small case study in 2 locations looking at the child perceptions about their welfare in North Jakarta and East Sumba. So because this is using up to 2009 data, so as a continuation, SMERU, again with the support of UNICEF and Pembangunan, tried to update the data using the most updated data, which is SUSENAS. We actually using SUSENAS 2010, 2011, and 2012. But at this time, I will only present the 2012 data. Before going into the poverty aspect of children, this is just to give you a background on how many children are actually in Indonesia. Children, they are using, in this study we are using the definition of children based on law number 23 and also United Nations Conventions on the Right of Child. So it's defined as anyone who are aged below 18 years old. So it's regardless of whether they are married or not, but only using the age as a determinant. So in Indonesia, now around 1/3 of Indonesia populations are regarded as children. According to census 2010, it's around 30 million children in Indonesia. If we look at the proportion of children, it actually declines over time, because in 2000 census it was 37% of Indonesia are regarded as children. But for this study, we need to mention that we are using Susunas, although Susunas is not a good data source to estimate the populations, but because we are using Susunas for the whole analysis, so I need to highlight that in Susunas 2009, the estimated number of children are 79.4 million, and in 2012, it's 84.36 million children. So in Indonesia, more than 70% of households are having children, and the distributions are until now in rural area are still higher than in urban area, but more children are now living in urban area. And just to give you a brief explanations on the methodology, we are mostly using the monetary approach to calculate the child poverty. In one dimension, there's monetary dimensions, using the 2010 study using 3 lines. One is the national poverty line, and one is the other is the international poverty line using $2 and $3. So we are not using 1.25 because we are comparing the data with 2003 data, and the 2003 has not used 1.25, so we are using $1 per day data. And also to look at the disparity across household welfare levels, we divide the children into 5 quintiles based on household expenditure, per capita expenditure. And then we are also looking at the non-monetary aspect, which is the education, health, the working children, shelter conditions, water and sanitation. Some findings from the 2010 and 2011 study. From this group, I think your copy is missing this part. This part, so basically it shows that the distribution of children is actually higher in the lower income. So if we sum up the quintile 1 and quintile 2, so it means that 40% poorest household, it has around 50% of all children. Yeah. So in the richest quintile, the proportion of children is becoming less and less. And this partly explains why the phenomenon is that child poverty is always higher than overall poverty in Indonesia, because the poor household usually have more children. So if we look at the trend from 2003 to 2009, child poverty declines along with the overall poverty. And as the overall poverty declines, child poverty also declines, but the child poverty tend to decline faster than overall poverty. It means that the decline in overall, the poverty reductions overall is very important to reduce child poverty. And if we look at the determinant of poor children in 2009, most poor children are more likely to be found in a female-headed household, and children living in extreme poverty with $1 a day is in all aspect, in all line, it finds more in a household with a larger number of household members. And also it is associated with the education level of the head of household. So if you are using the $2 a day line, you can see that the significant reductions only happen if the parents are actually graduated from, say, senior high school. So, so it needs a high education level of the parents to lift children from poverty using $2 a day standards. And it also shows that the child poverty is also mostly associated also with the working children. So in a household where there's at least one children are working, are more higher than the average child poverty nationally. If we look at the distribution with urban and rural distributions, urban are still dominates with always 80% of the chronic absolute children in absolute poverty are living in urban in rural area, and then and the proportion of children in rural area are actually higher than in area. And the distributions of the child poverty rates are varies across provinces. The highest proportions of poor children are actually live in Java, as most of children are live in Java. But the poverty rate, child poverty rates are higher in Papua, and then the lowest are in Jakarta. And if you look at the other dimensions, I just provide you with a summary. Can look that actually there is a lot of progress that has been made. In terms of education, if you look at the enrollment rate are increased. And then if you look at the early childhood educations, the percentage of deprived children, which is, means that children are not accessing, are not enrolled in early childhood education, are still quite large. Until 2009, so 2003 and 2009, there is an improvement, but it's still a high number of children are not enrolled in. And working children, I think everything is actually have a good progress, with the exceptions of water. I think the access to water is actually worse, getting worse. So this is access to improve water source. Yeah, so it is not the drinking water. So it is not access to safe drinking water. Because this does not include bottled water, so the difference is only this. But sanitations, although there is an improvement, but the level of achievement are still quite low. And if we look at the disparity across household income quintiles, it is apparent that in most of the dimensions, children in poorer households in quintile 1 are worse off than children in richer households, with the exceptions of water. So the deprivations on access to clean water is actually spread almost evenly across household income quintiles. And in the exercise in 2010, we calculate the multidimensional poverty. So we are using the indicators that are mentioned before to look at how many children are actually deprived in more than one dimensions. And this data shows that a lot of children actually deprived in more than one dimensions. So almost 50% are deprived in 2 dimensions and more. Yeah. And if you look at the trend, it's actually improving. I mean, the proportion of children who are deprived in 1 dimension or no deprivation at all is actually increased the proportions compared to 2003. And if we look at the still the same, I mean, looking at the multiple deprivations, but we look at the divided by income quintiles, we can see that it shows this similar tendency with the monetary poverty, that the children in lower household welfare levels are suffer more in other dimensions than children in a richer household. I think this is what we can estimate. And if we look at the other disparity aspect between urban and rural and across provinces, this report actually provides you with the indicators of all dimensions by province and also by district level. But please be careful in using district level data, as actually, the level of confidence is not too good, but we present it as to provide some insights to indications of what happens at the district level. But the provincial level, I think, is quite provide a good estimate. And this data just show you that actually, if we look at the disparity across urban and rural and compare it with the disparity across provinces, the disparity across provinces is actually higher than urban-rural disparity. In some aspect, urban-rural are not significantly different. For example, in aspect of enrollment in primary school and also in safe access to safe water, this is not significantly different between urban and rural. And but if you look at the disparity across provinces, the gap is very wide. So from this, actually there is a lot of discussions in the reports about the policy that are relevant in this, and we also look at some dimensions, because even though there is a progress at the national level, but there is a setback in the household, in the poorest households, for example, for nutrition and also for water. But basically, there is some conclusions that we need to look child poverty more carefully for the future policy development in Indonesia. And now I will provide you with some updates on the 2012 data. So this is still a very preliminary findings. We will still further process the data, and also there are some dimensions that we are not providing you here because we still feel that some of the data are still looks strange, so we need to do some more work on this. But overall, we have tried to calculate the child poverty level just using the national poverty line. We are not using the $1 and $2 per day because there's not yet an official exchange rate that we can use. From the official source, so we are not yet calculate the $1 and $2 a day. But if we look at the trend from 2009 to 2012, the poverty rate are actually declined as the overall poverty declined. So this is the poverty rate, the overall poverty rate. This is published by PPS. It declines from 14% to 12%. The child poverty rate actually declined from 17% to 14%. The child poverty rate in urban area is lower than in rural area. And in the rural area it declined quite faster. But if we I try to calculate the elasticity of how the percentage of the percentage of change from so 1% of change in 1% reductions in overall poverty translate to how many percent reductions in child poverty. And I find that compared to 2003-2009 period, which is 1.49, it means that 1 percentage point decline in overall poverty are translated to 1.49% decline in child poverty. The rate in 2009-2012 are actually slightly lower than during 2003-2009. It means that it's getting harder and harder to reduce child poverty without specifically targeting children. And if you look at the proportions from between urban and rural area, this is the absolute number of poor children based on the national poverty line. You can have a look here that the number of children in number of poor children in urban area, although it declines, but it's not too sharp compared to in the rural area. So it means that it is more difficult maybe to reduce. And if you look at the provincial share, and the previous pictures provide you with the poverty rate, child poverty rates, and the share of number of poor children across provinces. But here I try to look at not the child poverty rate, but the progression. So here the share are still more on the Java, East Java, Central Java, West Java are more still dominant. But if you look at this is the progress, average annual progress, and this is zero. This zero means that this is not changed. So minus means that there is an increase of child poverty rate in this province, and this is in particular in Jakarta. So there is an increase in child poverty rate in Jakarta. And at the national level, the average annual average change of reductions in child poverty are 6% per year during 2009 to 2012. And so you can compare. So this is the national standard. So all the provinces that are below this, it means they are perform worse than the national standard. The more than 6% are actually perform better. So this just provide you with a more analysis on the progress on each province. And if we look at the distributions of children across households expenditure quintiles, these figures show you that this is actually not changed very much here from 2009. This is a slight increase, but it's not too significant. So it means that the distribution are still pretty much the same between 2009 and 2012. And if you look at some of the progress that we have calculated, the progress in education, there is a good progress in education in terms of enrollments, early childhood education. There's an improvement in also in primary school, juniors, secondary, and also senior secondary school enrollment. Also, the dropout rate is declined, and also the access to education overall are also improved a little bit, yeah, because this is need a long-term perspective. But if we look at the distribution of children who was deprived in access to education, this is to show you the difference between urban, rural, and boys and girls, and also the expenditure quintiles. We can still see that the highest against rural area, which is a higher proportion. So this is we calculate this from 100% is all the children that are deprived. So more than 50% are in rural area. Still, boys are actually worse than girls. This is maybe unexpected. And if we look at the household expenditure quintiles, this is still some gaps. I mean, the gaps is quite high between the richest 40%. In particular with the poorest 40% of household. This is in education. If we look at the children without access to birth certificate, we can see quite a significant progress in 2012. And actually the progress are quite good in all households, yeah, and especially in rural area, I think the access are improved a lot. Although there is still some gaps, I mean some differences, but this, I mean, narrowing. If we look at the access to water and sanitation, there is also improvement in children without access to improved water source. If you remember from 2003 to 2009, it is actually getting worse, but now I think it's improved, yeah, but little bit, yeah, only a slight improvement. And there's a lot of also, but the improvement are mostly at the richest household, yeah. Because it's still for the poorest households, the access are still more children are without access to water, so it's getting worse for the poorer children, but improved in regular children. But for the access to sanitation, I think at all household welfare levels it improved. Yeah, this is percentage. So percentage of children without access. So from these preliminary findings, even though this is still a very preliminary, you can see that there is a reduction in child poverty, as I mentioned before, becoming less sensitive to reductions in general poverty. And child poverty in urban area, I think this is will be an emerging problems here. If you look at the trend, if the trends persist like this. So I think it can be seen from this the phenomenon. I mean, the overall urban and rural, the progress in urban are quite like it's very hard actually to choose in terms of absolute number, but the rural in a rural area are declining, and also if you look at the provincial level, especially in like in Jakarta, number of poor children, proportion of poor children actually increase. The other is this improvement in access to education, certificate, sanitation, and water. But this disparity across household welfare level still persists, and particularly on education and on access to water. So by this I end for this my presentations. I would be glad to have your inputs and also your comments.
Okay, thank you, Widjajanti. Okay, now we can start our discussion session. I think we can start by taking three questions first. Can you raise your hand? Please state your name and your institution, please.
My name is Afita from Pembangunan. Thank you for the presentation. I'd like to ask, because you mentioned there are several data that you study. Some of the indicators are different aspects. How do you manage that? In terms of one indicator or several? And then for the dimensions, how do you decide on this 6 dimensions to get to that? Thank you.
Is there any? Okay. Maybe I ask a question. Oh, yeah.
So it's Rob Smith from Cambridge Education. I suppose a question. Do you have any time series data that show the differences in the rate of change between 2003 and 2012? If you go back to the birth certificate, the 2012 birth certificate update, it's interesting to see that between the vast majority of a majority of the changes happened between 2010 and 2012, and much less between 2007 and 2010. So I don't know if there's anything further on kind of the rate of change across time.
Well, Esther from the NP2 we are in this report. We are using various data sources from, but we use this for analyzing various dimensions, particularly for the risk studies and demographic and health survey. We are using this for analysis on the health dimension. Yeah, because in actually when the various health dimensions, for example, the nutrition, underweight, prevalence, something like that is not available in SUSNAS, so it's only available in risk studies. and some in demographic and health survey also. So we also compare the result from various data sources. Yeah. And for working children, for example, we are using Susanas and Sakarnas because it has a slightly different definition of and slightly different questions in the, and we are also using the ILO and PPS survey in 2009 on working children, which is can be used to apply the criteria, the definitions of child labor. I mean, using ILO standard. So we compare the trend, but the overall trend I think is quite similar between the Sakarnas and Susanas data that shows that the proportion of children that are working only between 2003 and 2009 actually declined, but but the proportions of children with multiple tasks, multiple activities, we call it. So they are working, they are going to school, and also perform household chores. Actually, it increased. So this is, I mean, the general trend. But we are not yet finished. I mean, analyzing for the 2012 data. But for the multidimensional child poverty, we can only use one single data source because we have to look at one children's whether they are deprived in several dimensions. I mean the same children. Yeah. So we cannot use the other data. We cannot combine other data. At the time we tried to merge the risk studies and Susanas, but we are not success in doing this. So we are only using two Susanas. But with the note that the Susanas data on health actually have some weaknesses because in the Susanas there is no information on the nutritional status of the children. So it depends very much on self-reported health conditions. So self-reported work disrupted illness, work or school disrupted illness, and also self-reported case of diarrhea and asthma. So this is not too good actually, the indicators. And it begs to you on the why we are using 6 dimensions. We are actually adopting this from the global guidelines on child poverty and disparity study. But in terms of indicator, we adapted with the Indonesia conditions. So, and Rob, I think your questions about the children without birth certificate. We actually have data for 2009, yeah, 2009 and 2011. In 2011. The proportions is 36 overall, 36%. So I think this is a sharp decline on the children under 5 without birth certificate. Yeah, this is just the data that show this, but I think yeah, it could be related with the current government policy on target on universal coverage of birth certificate, universal access to birth certificate. Actually, I think the previous plan was to achieve this universal coverage in 2011. Yeah, the target is in 2011. So in 2012, we still have some. Yeah, some many. Yeah, but I mean, this is quite a good, good progress. Yeah, but still, and especially urban are more and more difficult. But I think from our study, I mean qualitative study in Jakarta for the 2010 study, we highlighted that among the poor household in urban area, there is a lot of problems actually to access the birth certificate. One of it is about the child status here. So a lot of children's be outside marriage. Yeah. So it becomes, I mean, yeah, they don't understand that actually children's outside marriage, formal marriage is actually can have a birth certificate, but they don't understand that, I mean, they can access this. And there is also a lot of children who are living with their grandparents, and their grandparents doesn't really understand this. So I think this become a problem here more and more. While in the rural area, the main problems actually was access, I mean knowledge, and also access to physical access to the civil registration office here. So I think with the progress, I think the programs already addressed this, so they have a good progress in rural area. Yeah, this is still my analysis, so we have to prove this here.
Okay, any other questions? Yeah.
My name is Umar Said. I'm not very familiar with the poverty. I used to work for the energy from Indonesian Institute for Energy Economics. But I'm also advisor to the Ministry of Housing. And there I need to touch with poor people. You have been using 6 dimensions to measure the poverty among children. Suddenly, to take this birth certificate, when this birth certificate falls into that dimension, to me, birth certificate is very loose related to poverty. Probably it's because of the level of education of the parents. If you look at the richest group of people, they still have 20 or something. And the way I see birth certificate is more dependent on the government policy and the quality of public service. Can you elaborate on that? Thank you.
Okay, one more question. Yeah. Two. Okay. First, the lady.
Thank you. I'm Lisa from Economic Business, VP. I'm just curious on your preliminary finding update. You said that reduction in child poverty becomes sensitive to reduction in general poverty. Why? And the second question, it means you're trying to say that before that, is it sensitive or very sensitive? Thank you.
My name is Widjajanti from the Ministry of Social Affairs. firstly appreciate for the researcher to give this result for us. I mean, it's maybe good information. The problem probably only for me and also maybe for others. I mean, poor or poverty. I mean, children and family. If we look at kind of poverty, maybe we should deal with on a family indicator, because you know that children is a part of family life. Commonly, when we look at kind of poor, we use indicator from basic needs, at least for basic needs, biologically, psychologically, social, and spiritually, BPSS. And then, on this research, you see from 5 or 6 indicators: education, working children, health, shelter, sanitation, and water. I mean, if you like to make more complete about this, this is probably you can see, you can put in this indicator. You see BPSS also from this 6 indicator here, so you can put it there, and then maybe in terms of make a kind of program and policy, maybe it will more easier. I mean, to set up kind of policy or program, because if we see that just for 6 pattern here, I mean 6 indicator here, maybe not so complete. Again, one more. If we see children poverty from family perspective, then we can only set up how to gear up family wealth, and then automatically children will be rise up of their food. So without set up kind of policy for children, if we set up kind of policy for family, maybe the children automatically will be also get good result for them. Thank you very much.
Okay. Valid.
First is about the birth certificate. Actually, I not provide you with the complete pictures of all the analysis here. I tried to cut it because this is very big, and I only have a limited time to give you a presentation here. Actually, there is when I presented the multidimensional poverty. This multidimensional poverty on education, working children, health. So this is only some indicators that are presented in this report. Which is in this report, actually we look at the educations, not only this, So it's educations on health. In health, we look at nutritional status, immunization, prevalence, health disruptive prevalence, and breastfeeding and everything. And then on the we call it the child protection sections. We have the working children's and access to birth certificate, children's outside parental care, and we also look at the access of children to social protection programs. So birth certificates are coming under this child protection. Yeah. And birth certificate is actually a very important aspect because this is part of this child rights. Yeah. Child rights to identity. Yeah, because without birth certificate, their access to education to have, theoretically, it will also limit their access to various government programs and also on their civic identity. Yeah. So that's why I put this. And actually on this this report we provide with two different data sources, yeah, from Susunas and also from demographic and health survey, and also looking at the reason why they are not having birth certificate. And from LIPI, okay, oh yeah. Why is it poverty reduction is becoming less sensitive? I mean, this is also something that maybe this analysis has been not so thorough and looking at, I mean, why this is, but this is the fact, the case. But I think if we look at the distribution of children across household quintile, if maybe we can further disaggregate into decile to look at the proportions. But I guess that the proportions of children's the family with more children are difficult to improve the welfare. So if welfare improvements only occur in the household, poor household, which is have less number of children, so it translates to less children being getting the benefit from poverty reduction, overall poverty reductions. So maybe more on are not the household that doesn't have children or have less children. But actually, I think if you look at the number 1.47, it means that if you, I mean, the overall poverty reduced by 2, it means that 1% is the child poverty reduced by 1.7. But 1.4. But I think if this trend persists in the future, I mean, they are becoming less and less elastic. It means that the poor children are not having benefit from child poverty, reductions in poverty. So it means that only adults are actually greatly improve their welfare. The others is from Ministry of Social Affairs. About the indicators, yes, some of the indicators, here the definitions of poverty that we are using are multidimensional poverty. It means that the monetary poverty only a part of the poverty dimension. Some are not related with monetary. So that's why we are analyzing by quintiles to see whether this kind of deprivations are happening across welfare quintiles. So regardless whether the parents are rich or poor, the children are still deprived. It means that they are poor. Yeah. But some of the indicators that we are using here, like education indicator, working children indicator, health indicators, are attached to the individual. So it means that we are looking at the individual basis. But for shelter, water, and sanitation, it attached to household, because if the household doesn't have sanitation facility, it means all the children there doesn't have it. Yeah, so it attached to the household level. But some other indicators that we are presented here mostly are attached to individual. And we looked at the case, I don't present it here, but I think in the report, besides water, I think other indicators that children are deprived across welfare level are breastfeeding. The breastfeedings are actually at reverse here. So poorer household, children in poorer households tend to be breastfed by the mothers. I mean, compared to children in a richer household. So it's reverse the tendency. More and more children in a wealthier household doesn't receive breastfeeding. Babies, I mean, breastfeeding, for example. And then about this other social aspect here, we are challenged by the data availability. I mean, conceptually, it also includes the not only physical, but also psychological well-being of children. But in our data set, only this not available all these indicators here. In the report, we are using some other national data set which is available there. We are using IFLS to look at the interactions between parents and children. Yeah, in the we are looking at the frequency of children's meeting with their parents. Yeah, and we are not able to yet disaggregate across household quintiles, but there is a tendency that I think it's in rural area, more and more children actually have less frequent meeting with their parents. For example, this is a highlight. I think in urban area, I think the interactions are improving, but not in an urban area. In urban area, more and more children are actually meeting with their parents annually. It means only once a year. Monthly also, which is daily is actually reduced significantly from 11% to 7%. We compare the IFLS data from 2000 to 2007. Yeah, so this is, but because this is not available in the national data sets such as SUSENAS, we cannot do a comprehensive analysis of multidimensional child poverty which integrates the physical and non-physical and psychological aspect of child well-being.
Is there any other question? Two? Okay. One, two.
Thank you. Good morning, all. My name is Putra. I'm from Bappenas. Actually, very new in Bappenas and also very new in some issues. So I'm still in the learning process. as you mentioned in the last slide, child poverty in urban area is emerging problem. I think we need to know what is the factor is child poverty in urban area is emerging. I think poverty in urban area has more complexity problem. Not for children, there is vulnerability to violence, neglect in urban area. So it would be a good insight for policymakers for making a program in urban and rural. So I think it's a good statement, but we need to know more about factors behind the poverty in urban area. That's all for me.
Thank you. I'm Destri from Pembangunan. First, thank you to Bu Anti because you have updated this study with Susunas 2012. This is very useful for Bapenas, especially as input to background study RPEM 2015-2019. I think in terms of equity in children development, but Bu Anti, I hasn't seen in analysis from Susunan 2012 in terms of working children, early marriage, early marriage, and related indicator to violence. Thank you. Immunization also. Thank you.
Thank you for the presentation. I'm Clara from PEN. I'm just wondering if there is any research done that looks at the poverty according to the children, how the children define poverty. I know all the indicators are quite probably well accepted among adults, but how about the children? I think we should move progressively to a more child participatory research. Thank you.
I think this is
First about the child poverty, the increasing problems of child poverty in urban area. I think that some of the reasons behind this is actually in Indonesia now we have very fast urbanization phenomenon. Yeah? So a lot of I think it's now almost 50% of the Indonesian population are now living in urban area. With this, I think overall the trend, the trends in urban poverty is also increasing. The overall, the general, and I think with this, this is some of the reason why also child poverty is becoming more urbanized phenomenon, and the child poverty in the urban area, I think, is becoming more a problem. Yeah. And the urbanization in Indonesia is not only because of the physical movement of the children, the people, but also because of the expansions of the city area physically. Yeah. So some of the rural area now is becoming more semi-urban, urbanized. I think, yeah, look at like Greater Jakarta. Because before Depok is considered maybe more rural area, now it's a very city area, and the children are living the area. And I think for long time, the urban poverty was not really really have good attentions yet. And in this report, we have also tried to analyze the disparity across quintile, looking at the urban and rural area. And I think that there was also discussion in UNICEF that we have to look at the more carefully, because the disparity level actually between urban and rural area actually almost the same. So the conditions of children in a urban area, in a poor family, is actually almost the same with the children in a poor family in a rural area. So while the conditions of children in a urban area from the wealthier family are much more better off. Yeah. So this is the disparity in a condition of children in urban area is actually worse than, overall it's also the equality in the urban area. If you look at the Gini ratio is also higher, and the condition of children is actually also similar with this. So I think, and also in the condition, I think it's become widely discussed that the conditions of poor children in urban area is much worse in terms of protection, because they are more vulnerable to abuse and also have a lower quality of life because of their shelter conditions and everything. So it becomes. But I will show you some of the figures if it is available here. And what they say about equity and other dimensions. Actually, we are going to also calculate other dimensions. All the dimensions that are being calculated in the report, which is available in Susunas. So we are going to do this here. But actually, we have already process about the working children's early marriage, and the immunization are still in the process. But I have to be frank to you, but the figures that we got from working children is a bit strange. So I still would like the team to look at the estimations again. Sorry, I'm trying to be very careful, not to, because I know that once this is in the public, so I have to be really accountable for this. And the data that I have, preliminary findings that I have presented in this, I think it has been double checked. So I'm quite confident that this estimate is quite reliable. But some of the other indicators, I think, will follow soon. I think we have to speed it up because it's already been asked very many. But I think for the immunizations, really,
there is no immunization data in Susunan.
but it's self-reported immunizations. But I have.
Yeah. So I think from Susuna's, I mean, because in this is Susuna's, we have self-reported immunizations, but we have to note that this will be slightly different if we already have the, it should be have a risk test soon, yeah? Yeah. Yeah, because if when we compare the risk test data and also demographic and health survey data, yeah, which also have the Susuna's, they have the immunization data, it's a little bit different, yeah. But we will also calculate this one. Yeah, early marriage also. And about child welfare according to children's poverty. Yeah, in the reports, actually from our qualitative survey, we try to explore the perceptions, but the way our approach is not asking them about what do they mean about poverty, but more on the kind of problems that they face. So this is some data that I mentioned to you before, frequency of fusions between with both parents. This is urban and rural area. This is so this is from the qualitative study. We look at the problems and situations contribute to sense of deprivation. So, I mean, whether they feel that they are deprived. Yeah. So, we distinguish between age group because it's different. So, we look at what the primary school age children feel. Yeah. Why they feel deprived. So this is some material aspect and non-material. So, and from this, I think there is a lot of psychological aspects that are actually come up, which is not, I mean, available in the national data set anywhere. So, including relationship with the teacher, the parents, yeah. So what is the problems? Yeah, this is, but this is very limited because at that time we have very limited time actually for the preparations of this study. So the coverage of this study also only in two areas, North Jakarta and East Sumba. Yeah, so in North Jakarta is to look at the urban children in child poverty in urban setting, and the other is in a very remote area in East Sumba. So we have this geography and also source of well-being. So this is from the school discussion with the children.
Last three. Okay, last three question. good. The lady in front.
Thank you for the informative presentations. I'm just wondering that maybe we also need to talk about the policy implications of all of this. So the idea is, if children now live in poor household, most likely they will grow up as poor adults later. So the interventions that we need to prioritize in order to prevent that from happening, so that we don't want the reproductions of poverty over time. I think we have not discussed that specifically now. In my mind, there are two kinds of interventions. One is the one which directly improves the conditions of poor children now, so they are not become not too deprived. And the other one is the policy to help them avoiding poverty in their adulthood. So let's discuss about these two types of policies.
Thank you very much for an excellent presentation. My name is Jo Hashim, I'm from Cheltenham. You alluded just now about breastfeeding practices, and you suggested that the wealthier were actually breastfeeding their children less. Can you explain a little bit more about that, please?
Okay, last one. Okay. Okay, I think that's our last question. So, Widjajanti.
Yeah, the policy implications, I think this is a very important aspect that I'm not really discussed this, but in the report we are providing some policy recommendations which is based on the dimension and also the overall, to attack the overall, not overall, but in a general sense, yeah. One is for the, because I think the first is this report tries to look at from the perspective of child rights. It means that they try to avoid the future poverty by providing the right of the children. So they have the rights to develop, so rights to education, including the identity, the right to health. So I think this is some things that should be provided by not only the governments but the other stakeholders also that are involved, and it's the layers between families and then the communities, also the state, and the governments. Yeah, but so this is to avoid the future poverty because of, like, if they are like lack of education, they are lack of health, they will get a higher chance to be poor in the future. Yeah. While while they are already that they have to other aspect, especially the opportunity to join labor force, something like that, is also depends after they are becoming adult. Yeah, there is some issues that here are quite actually sensitive, like working children. Some of the children already join the workforce very early in their age, and this is actually, if we just look at straight, it improves the income of the family, but not the welfare of the children. So this is also some of the protection issues. So providing holistic protections to children to fulfill their rights, I think this is one of the aspects. So that in the reports we provide some recommendations on each aspect of the dimensions on education, on health, on protections, and also on the social protection. But overall, I think there is at the end of the reports, we provide some policy recommendations on how to address child poverty, not similar to all area, because child poverty problems in the more remote area, I mean, in each province could be different. Yeah. So we have to, in some area we just have high proportions of child poverty. It's, I mean, should be more with the general approach of universal coverage for all children, and more targeted interventions maybe for the children in a area where the child poverty rate is actually low, like in Jakarta is actually very low, but it has to be really targeted to them. I mean, and I have to maybe mention, I mean, I forgot to mention before to you that this is based on Susuna's data, which is have to be carefully looked at because it doesn't include the children that are street children in a non-conventional household there. Yeah. So children like children in dormitory, it's not included in this analysis. So this is still, some of them are actually very poor, yeah? Especially street children. Yeah. But street children are, we also discussed in this report that by definitions, it's difficult actually to count street children because, like the phenomenon we found in the qualitative study in Jakarta, street children can be distinguished into the children that are working in the street and children that are living in the street. Yeah, so the children that are working in the street but they live with their family, actually, they are already counted. But the children that are living in the street, this is not counted. Yeah. And for this exercise and for this report, we actually try to collect data from other resources about this specific case of street children, children living in the street and also in dormitory, but we cannot find any data source, so this is still lacking in this report. And the others is back to the policy. I think there was during this development of this report, there was a debate about the approach to this child poverty because Indonesia is one of the countries that have high proportions of children in dormitory, so it's not family care. But I think the approach now is to bring back the children to the family. That should be. So that's why the approach now is to help assist the family to be able to fulfill the right of the children. So that's why the social protections issue becoming more, child-sensitive social protections becoming more important approach, I think worldwide also. And especially in Indonesia, I think this is already highly advocated to the government to provide social assistance to the family so that the family will take care of their children better and fulfill their rights. And about the breastfeeding, here we provide some data. breastfeeding zero. This is based on research data, because the Susuna's data doesn't have this kind of extensive information. So in research data, the 2010 research data, you can see this is based on quintal, so quintal 1, 57.4, and in the richest quintals it's very low. And I think from our case study in North Jakarta, I think for the urban in an urban area, especially in the poor household, they have problems of also difficulties in economic. They discover how economic difficulties makes them also have a limited capacity to breastfeeding because of their daily activities of the mother after the giving birth. They have to work outside the house without the chance to give breastfeeding. So it's also a kind of problem. But also the understanding about why inclusive breastfeeding is important. I think this is also still low. Yeah. But lately, I think there's already a lot of government efforts to increase the breastfeeding practice by prohibiting the hospital to provide formula.
Why the higher quintal got lower breastfeeding rate?
We don't really understand. I mean, why? But I think we don't really understand why this. But I think, according to Risk-Just report, I think there is a willingness of the mother also, and it also influence the decisions to give breastfeeding. And for working mother, I think we know that in Indonesia the facility to give breastfeeding are still very limited. And also a lot of I think for the middle income family and lower income family who's also working like in a factory, there's no facility for breastfeeding, while they in the house they also doesn't have refrigerators to keep the milk, fresh milk. So this is also a problem.
Okay, thank you, Wanti. And before we close this, since this report was conducted by SMERU and in a close cooperation with UNICEF, and we have Ibu Nilofar here, do you want to say something?
Thank you. Just to thank Widjajanti and of course Faz and all the researchers. I know quite a few of them are in this room for their persistent commitment to bringing out really excellent child poverty study, and the first in Indonesia. And I think even in this process of 2-3 years of deliberation and working on this collectively, with the support of all, especially the leadership of Bapanas, and really their commitment to addressing child rights more holistically and poverty reduction more holistically, collectively we have been able to raise awareness on child-sensitive poverty reduction and on child poverty in ways that perhaps were not quite there. And as Ibu Destri said, it's very timely because the government is working on RPGMN for the next 5 years, and SMERU is contributing to the 25-year poverty reduction plan. So I think all of this can come together quite well, and it's great that Ibu Anti and her team are already working on the update because several government counterparts and partners have asked us for that, as you mentioned. And also parallel, having some discussions and working on new methodologies of child poverty study as well, which I'm sure at the right time we will be sharing with our partners. So really this is for us in UNICEF also very exciting to finally have this book in our hands, and the policy brief and the CD-ROM, and we look forward to receiving feedback and ideas and suggestions for working further on this, but also, as Paasa mentioned, of course, the very important issue of policy recommendations and how to have dialogue and really try to advocate for these findings and others to be used for decision making. So really just thank you all and all the participants today from the various government and other organizations. Thank you very much.
Okay, thank you, Niloufar. So that's conclude our discussion this afternoon, and please join me to give appreciation to Ibu Anti for I think we have lunch, yeah, at my left side. Please help yourself and have a good day. Thank you.
Thank you.